Awesome. Can everybody hear me okay? Great. So hi, everybody. I'm Lindsay Sizemore, Viral Hepatitis Program Director for the Tennessee Department of Health. And as a reminder, I will be your facilitator for these sessions. So although we're not going to do this every session, given this is a brand new project and we're really trying to build a community of practice, I'd just like to take a few minutes this session just to have everybody briefly introduce yourself, so just your name and your organization. We really want to know who's here and who our Hep C treatment champions are. And just going forward, we're going to do this via the chat, so I promise that we're not going to spend 20 minutes each call doing introductions, but I do think it's important to do it now. So when I say your name, please turn on your camera, come off mute, and again, tell us your name and your organization. And I'm just going to go down the list as I can see it. So we'll start with Heather.
Hi, I'm Heather Wingate, and I'm with the Tennessee Department of Health. And apologies, my camera is not working today, of course.
No worries. Thanks, Heather. Melvin?
Hello, my name is Melvin Smith. I'm representing the Tennessee Department of Mental Health and Substance Abuse Services. Thank you.
Hey, Melvin, great to see you. Thanks for coming.
You as well. Thank you.
Stephen?
I'm Stephen Miller. I'm the health officer for Hamilton County.
Welcome. Thank you. Abigail? Abigail Cox? Okay. Anastasia?
I'm sorry, this is Abigail. I am on a call, so just real quickly, my name is Abby, and I work for the Department of Health.
Great, thank you, welcome. Anastasia?
Hi, I'm Anastasia, and I work for the Department of Health.
Thanks, Anastasia. Okay, I apologize if I mispronounced this. Is it Asish? If you're talking, we cannot hear you. Okay, we'll come back. And I apologize, you all, the order is like moving all over the place. I'm going to try to stick with it, but if I skip you, I'll try to come back. Brooklyn?
Hi, I'm actually from the Minnesota Department of Health, where we are embarking on a very similar Project Echo. So I'm just here to learn from you all today.
Welcome. All right, Dr. Clark Allen?
Yes, my name is Clark Allen. I'm a pharmacist at Regional One Health in Memphis.
Thank you. Clover?
Hi, I'm Clover. I'm with the Tennessee AETC.
Welcome. Dr. Chastain?
Hey everybody, I'm Cody Chastain. I am a physician at Vanderbilt University Medical Center and the principal investigator for the Southeast AIDS Education Training Center.
Thank you. Cynthia?
Yes, I'm Cynthia Mantooth. I'm a nurse practitioner with Cherokee Health Systems at their Morristown location.
Welcome. Danny?
Can you hear me?
Yes.
Okay, I'm sorry. I don't know why my camera's not turning on. I'm Danny. I work at TDH as an FE in the hepatitis group.
Thanks, Danny, and no worries. It seems to be just a theme today. Everyone's having issues. Maybe it's the ice. Okay, Dr. Debbie Allen. Dr. Allen, if you're talking, we cannot hear you.
I'm babysitting. Debbie Allen, I'm an internist with the East Region.
Got it, thanks. All right, I see two Aaron, so we'll start with Aaron Lancaster.
Hi, I'm Erin. I'm the viral hepatitis coordinator for the Southeast and Chattanooga regions, covering the perinatal program and the viral hepatitis prevention and the navigator.
Thank you. Okay, and the other Erin? It just says Aaron, so I'm not purposely omitting your last name. I don't have one. Okay, Gina? Gina McMillan? Okay, Hillary?
Hi, I'm Hillary. I'm with the Department of Mental Health and Substance Abuse Services.
Welcome. Jennifer Bird?
Hi, I'm Jennifer Bird. I'm viral hepatitis case navigator for the West region.
Thank you. Candy?
Hi, I'm Candy and I'm with the East Region. I'm the viral hepatitis navigator.
Hi, Candy.
Hey.
Kimber?
Hi, my name's Kimber. I'm the viral hepatitis data processing manager.
Thank you. All right, Laquita.
Hi, I'm Laquita Richards. I'm the viral hepatitis data processing system manager.
Thank you. Laura?
Hi, Laura Price with the Tennessee Department of Health.
Thanks, Laura. You all, it's like making me nauseous. All the names are going all over the place. I'm doing the best I can. Okay, Melissa Moon.
Hi, I'm Melissa Moon. I'm with Tennessee Department of Health.
Great. Mithra?
Hey everyone, Mitra Somasi. I'm the Project Echo Manager at the West Virginia CTSI Project Echo. Thank you.
Thanks for being here. Dr. Talley?
Hi, Pam Talley. I'm with the Tennessee Department of Health.
Thank you. Philip?
Hello, I'm PJ Hayes with Gilead Sciences.
Welcome.
Thank you.
Shamia?
Hi, I'm Shamia Mia with the Tennessee Department of Health.
Thank you. Sherry?
Hi, I'm Sherry. I'm with the Tennessee Department of Health, the Viral Hepatitis Prevention Navigator.
Thanks, Sherry. Stephen?
I believe I already introduced myself.
Oh, you did. I am so sorry. It, it was not. It was not in alphabetical order, and now apparently it is. William.
My name's William Boylan. I'm a nurse practitioner at WellPath, and I provide clinical decision support surrounding hepatitis C for my organization.
Welcome. Thank you. Okay, I think I got everybody, but I cannot be certain. So did I miss anyone, or has someone that I called on that was not able to come off mute, able to come off mute now? Echo pause. Okay, great. Thank you, everybody. It's really helpful to know who all is here. And also, as you can imagine, we have a reason for such a large Tennessee Department of Health presence because this is run out of the Tennessee Department of Health. But again, I'm hopeful that we can continue to grow and continue to identify more hepatitis C treatment champions. So I first want to thank everyone for attending the last session and for the overwhelmingly positive feedback we received from those of you who completed the evaluation survey. I'd like to now do a quick review of the overarching themes from that evaluation survey and also do a few anonymous polls just to see if we can be a little more interactive and because we really want to dig a little deeper with some of the issues raised. So, okay. So the evaluation feedback survey from January 18th. So most participants felt that their knowledge of the session topic increased after the session as compared to before the session, which is always great news. Next slide. All participants said they will use what they learned in the session in their work, and some specific examples were pediatric screening recommendations and overcoming barriers to hepatitis C treatment. And this included kidney function, not a barrier to treatment, genotype testing, not a barrier to treatment, and complicated cases, not a barrier to treatment. Next slide. Most participants said there are no barriers that will prevent them from using the content provided. However, a few mentioned lack of time and/or lack of resources. And so we wanted to do a quick poll and just ask you all, what resources do you feel that you need to be able to either screen for hepatitis C or treat for hepatitis C? So you should see the poll come up and just please enter your comments there. And just a thumbs up from someone, anyone who's completed it, so we make sure we're giving you enough time.
Hey, Lindsay, I'm able to see how many participants completed it out of the 31. So just let me know the threshold. I can let you know.
How many have completed it so far?
So far, 7.
Okay, we'll give it just another minute. Heather, have we gotten a few more?
We are up to 38% or 41%, so 13 out of 31.
Great. Give it one more minute, then we'll close the poll.
And I'll just say this can be any kind of resource. We have, people have asked about infant testing in the past. We've had people ask about patient handouts and education. We've had people ask just, where do I start when I want to implement hepatitis C? Ideas about how to put prompts into EHRs, so anything like that. I don't think anything's off limits, just some ideas.
Very true. Thank you, Mia. Okay, Heather, let's close the poll and see what we got.
All right, I will share the results. Are you able to see the results?
No. You may have to read them. Sorry, you all, we're trying to work out the kinks with the Zoom polling, so bear with us.
One moment, I have to sign in. Gotta love having multiple Zoom accounts. Okay. All right, let me stop my share so I can just share the results via screen. Also would help if I'm not working off of 3 desktops right now. So let me just find the correct one to share. All right, should be this one. Lindsay, are you able to see?
Yes, so it looks like it says more training on efficient practices. Okay, all primary care sites are currently treating. I would like for APNs to start treating and possibly offer treatment in non-primary care sites. Prescription support, none. Prioritization of hepatitis C treatment team nurses, hub and spoke referral, time required for PAP, patient assistance plan, more providers needed in the health departments and more awareness for clients, access to rapid tests and a list for facilities that provide treatment to uninsured clients, patient assistance to cover costs, the state to be able to do the labs and funding for ultrasounds. I'm not sure, that's very fair, that's why we're all here. FibroScan, additional hepatitis C navigators, and just better education and awareness that is available at our office. Okay, these are all great. I do want to just, if we can, talk about a couple of these. I just want to try to understand a little more. So if this was your suggestion and you're willing to come off mute, we would really appreciate it. So when you say prescription support, whoever suggested that, can you come off mute and talk a little bit about what exactly you mean with that?
That was mine. Sorry about that. So, I find when I train providers or clinics that one of the biggest barriers that they find is what staffing or what resources or what algorithms or ways can they do to decrease the work burden on staff to help negotiate and navigate getting the appropriate medication that's already been selected approved, filled, and delivered to the patient. And that's a process that sometimes falls outside the scope of the initial clinical evaluation and prescribing, but it's a throughput barrier that often stops clinics from implementing larger scale practices.
Thank you, Dr. Chastain. So as those of you who were here last time know, Dr. Chastain is one of our SMEs, and I promise that was not planned at all. Okay. hub and spoke referral. Let's talk a little bit about that. So if that was your suggestion, if you could come off mute and just talk a little bit about it, give a little more context, we would appreciate that. Don't be shy. We're all new here. Okay. Asich, I saw you trying to come off of mute, and I know you were having issues with your audio. So I'm not sure if that was your suggestion, and if you're able to come off mute now, and if not, if you could put it in the chat. Great. Would you be willing to just put a little bit about it in the chat and I can read it for the group? Okay, and while we are waiting, oh, meaning that a single easy referral place. Okay, gotcha. Okay, more providers needed in the health departments and more awareness for clients. We're going to be talking a little bit about some health department initiatives today, so I hope that that will be helpful to whoever put that in there. Access to rapid tests and a list for facilities that provide treatment to uninsured clients. So whoever put that in there, would you be willing to come off of mute? Because we do partner with several agencies to provide rapid test kits for Hep C. And we also have navigators that keep directories where we are able to see which providers will take uninsured clients. And so hopefully you'll learn a little bit more about that today, but wanted to just note who made that comment.
Hi, Lindsay, that was me.
Oh, hi, Kimber. Thank you. And yes, we have plans to increase partners that we're working with on that. Kimber and I have been hard at work trying to identify who those could be. Okay. Dr. Chastain or Dr. Allen, do you want to comment on any of the feedback provided here, specifically with funding for ultrasounds or FibroScan? Anything that you want to add to there?
I don't have anything. I don't have anything to add quite yet. I think that this is a goal for us to kind of ask if you're encountering these challenges. We need to hear these challenges so we can think about what type of education, what type of resource, and the things for us to feedback. Don't have answers for you quite yet.
Great,
and
thank
Lindsay,
you.
I wanted to point out another comment in the chat about when we were talking about making a one-place referral. Another comment was almost like poison control, where anyone can call in and get quick information advice and where to get next step. And correct me if I'm wrong, Dr. Chastain, but I think this does exist as like a hotline where people can call to get some general information. Is that correct? Am I misspeaking?
So there are a variety of resources, both at a national level and also at a more regional level in this context. So Dr. Patel, I can reach out to you directly, but I think, again, as we think about this as a program, if that's a resource and how we want to house it and how we want to promote it, the Southeast AIDS Education Training Center, including myself and others, can provide that resource, but there's also national groups as well. What I think this is most helpful for is actually hearing from you all as a group about where are the communication breakdowns when there are things that have been built or developed, and yet those aren't readily accessible or awareness. So this is really helpful for us to consider that as well.
Great, thank you both. Okay, Heather, if you could go back to the to the PowerPoint. And next slide, please. Okay, so some suggestions for improvement were noted, such as more time for case studies. And so I just wanted to highlight here, we are happy to provide the time and the space for that, but you all need to submit them, please, because we want to hear from you and we want to know what kind of questions that you have. Screening for hepatitis C in adults. So Shamia will let you know where you can find this information in her portion of the didactic presentation today. Topic suggestions, so please submit these in the request for topic survey so we can add them as a didactic presentation in an upcoming session. and then another poll. So we just want to ask you all, how can we make the sessions more engaging? And so you should see the poll pop up, and there are a couple options here, and then you get a first choice, a second choice, a third choice, and it says a fifth choice, but that should be a fourth choice. So please ignore that. But please rank your choices, and then we'll discuss in just a second. And I also wanted to mention there is an other, and it will ask you for some more specifics in a second, and we can dig into that a little bit too. Okay, and my screen did something weird. So it is actually first, second, third, fourth, and fifth. You just have to scroll to see the fourth choice, or else it looks like it goes from third to fifth. Heather, how many responses do we have so far?
We're up to 64%, so 20.
Great, we'll give it just one more minute. Okay, Heather, can you go ahead and share it?
Yes, let's see. I'll click share results again.
Okay, so, wow, that's colorful. Okay, so it looks like the first choice for many was kind of that lighter blue, which I'm seeing as polls. Let's see. Then we had what looks like asking questions anonymously, then breakouts, calling on audience members, and then other. Okay. Heather, are you able to see if folks chose other, what kind of feedback they provided?
Yes, I can, but from what I see, it was 2 participants and both of them said not applicable. Can't say that word.
Great. Okay, sounds good. We'll take all of that into consideration. Thank you all so much. So going forward, we want to spend a few minutes highlighting the evaluation feedback on the second session of every month, starting in March, which will cover both of the sessions in February. So again, we just really want to make sure this is a valuable use of your time and a valuable resource, and we really want to be responsive to any feedback that you might have. Okay, next slide. Okay, so today's agenda will include introductions and announcements, which we did the introductions and we'll be going to the announcements in a second. A didactic presentation by myself and Shamia Roberts, which will highlight linkage to care and hepatitis C resources for adults. We'll have one case presentation that focuses on a postpartum woman, and then time for Q&A and closing remarks. Next slide. So a few quick reminders I want to highlight that you may have seen when you joined the session. So this is the most important announcement, so please listen carefully. I need everyone, including the subject matter experts and TDH folks, to take 2 minutes to complete the sign-in sheet here. You can utilize the QR code pictured here on the left side of the website, on the left side of the screen, or the website, which Shamia will put in the chat. The sign-in sheet is a simple form. This is required for our accrediting body, and it's the only proof we will have of your attendance as far as they are concerned. If you do not do this, we will not be able to offer you CE. And even if you don't want CE, we need you to complete it. So I'm going to give everybody just a minute to do that right now. And when you're done, please give me a thumbs up.
And Lindsay, while people are working on that, how about we turn it over to Dr. Chastain to talk about that registration as well? Is that okay?
That is perfect. And thank you for reminding me about that.
Okay. Absolutely.
So folks, not to add to your evaluation or documentation burden, but part of the reason I'm able to participate in the series and also provide viral hepatitis related education is because of my role with the Southeast AIDS Education Training Center, which is a HRSA federally funded entity. And we provide training for free. So for those of you who need additional assistance with HIV education, viral hepatitis education, and or technical assistance for your clinicals or program, we can provide that to you. You can reach out to myself directly or Chloe Tipton, who is on our checking sheet. The way we provide all that stuff for free is basically by counting who is participating in programs. And so I would just ask you to, if you're able and willing, to click on a link that's going to be dropped here into the chat box. We'll drop it a couple different times because there's lots of thumbs up coming through, and so don't want to lose track of it. That is a registration for the Southeast AIDS Education Training Center as a sign-in. It will have a few more details than what's there. Once we have people in our system, we are able to count them in the future. So we will not have to do this per se every time for individual folks. So, but thank you for your time, and thanks to the team for allowing us to put that forward.
Of course, thank you.
And I'm going to sign in. I have to do it right now, so I'm signing in. So keep going.
Okay, great. Thank you. Okay, next slide. Okay, so just a quick disclaimer. The Tennessee Department of Health Hepatitis C project ECHO sessions are intended for prescribers treating or interested in treating hepatitis C and their clinical staff. Next slide. So please turn on your video and mute yourself unless speaking, and please come off mute to ask any questions that you might have. We really want to have a community of practice where we're all engaging, and if we are the only ones talking, that makes it very hard to do. All sessions will be recorded, and sessions will be available on YouTube within a week. You can find these recordings by visiting our website, the link in the QR code on the right side of the screen, and clicking on the View Past Session Recordings red button. Shamia will also put the link in the chat. Please take a moment to rename yourself in Zoom with your first name and last name. If you need assistance in doing this, or if you have any Zoom tech issues throughout the session, please private chat Anastasia for assistance. Anastasia, has anyone joined by phone?
Not yet. Nope.
Great. Thank you. Next slide. So as a reminder, please never discuss PHI, and please always treat everyone with respect. And finally, you must be present for the entire session to, and complete a short evaluation survey within the next 48 hours to be eligible for the full 1 hour CE. The evaluation survey will be emailed to you post-session, and after the evaluation survey is completed, a link to download your CE certificate will also be emailed to you. Please note there's one additional step for pharmacists within the evaluation survey. So with that, Shamia and I are ready to provide our didactic presentation for today, and I will kick us off. So as I mentioned, we're going to be talking about linkage to care and hepatitis C virus resources for adults. Next slide. So first, a little epidemiological background. Hepatitis C is very underdiagnosed and underreported, yet despite this, it was estimated that nationally, there were 2.3 million Americans, or 1% of all adults living with Hep C from 2013 to 2016, and of course, we know that this is higher now. Next slide. We also know that 9 states represent more than half of all people living with hepatitis C nationwide, for at least the cases that we are aware of, and that Tennessee is one of these states. And we also know that the face of hepatitis C has changed. So while 3/4 of Americans living with hepatitis C are baby boomers, or those born between 1945 and 1965, the largest increases in new infections over the last decade have been among people under 40 years of age due to increased injection drug use associated with the opioid crisis. So the Tennessee Department of Health Viral Hepatitis Program is a newer program that hired our first staff person, which was me, in 2015. And this was largely in response to what happened in Scott County, Indiana, which was an HIV outbreak related to injection drug use. As a lesson learned from the HIV outbreak in Scott County in 2014, we know that high rates of hepatitis C can be indicative of drug use transmission networks, and that they often precede HIV infection and outbreaks. And for those of you that don't know, in 2015, CDC looked at the counties most like Scott County, or those most vulnerable to the rapid spread of HIV or hepatitis C. So what they did is they looked at the top 5% of counties in the US, or the top 220 counties. And Tennessee actually had a significant amount of those, which you will see on the next slide. So we were second only to Kentucky, and that we had 41 counties that were identified as high risk of our 95. So with that, I'm going to turn it over to Shamia to talk about resource allocation.
Afternoon. Yes, next slide. Perfect. So we're going to start this section with another poll question. So Heather, perfect. And Heather, after we get a decent amount, I think we're good to share the results.
We're at 65%.
Awesome. That sounds good.
All right, I'll go ahead and end the poll and share the results.
So which of the following is a confirmatory test used to identify active hepatitis C and need for treatment consideration? We talked a little bit about this last session, but we just wanted to highlight it again here too. And so the correct answer is hepatitis C viral load, or RNA, or your PCR test. So it's a really important test. Genotyping, though, for some treatment especially, is another important component as well. So I can see where sometimes that is included, especially if you're looking at certain insurances and things like that. We'll actually talk a little bit more about that today as well. So great. Anybody want to add anything to that before I continue kind of jumping into some of our resources? Or does anyone have questions about that either? Okay, let's go on to the next slide. Thank you. So increasing hepatitis C testing is a critical component of eliminating hepatitis C. As briefly mentioned earlier, TDH does support hepatitis C rapid testing, or this finger stick testing that's mentioned here, through different community-based organizations. And that was dropped in the chat earlier as well. But we also do reflex testing through our health departments, all of our health departments now since 2017. And that was kind of ties into our last question about that confirmatory testing. So both tests help ensure that patients can be linked to appropriate resources and or treatment. So while this is from a health department perspective and kind of what we're doing, we're happy to support, others and being a resource to refer patients to for that testing as well. And another resource in the area, there are different syringe services programs, or SSPs, that provide HIV and viral hepatitis testing and linkage to treatment, as well as comprehensive harm reduction services, including providing free sterile needles, syringes, and other injection equipment, safe disposal containers as well. Overdose prevention and education is also included, as well as referrals to substance use disorder treatment facilities, different medical providers, social services, and then HIV, STI, and viral hepatitis prevention education is typically included as well. So this map shows where our current SSPs are, and I know some of that has grown since this map, but you'll see the link here to view those as well and find the addresses and hours and things also. So a great community resource. Next slide. There was mention about where can individuals without insurance go. So this map shows the counties where our health departments are currently offering hepatitis C treatment. I will say, since this map, which it was updated at the beginning of the year, but it's already being updated again in the process of updating, because now we have 41 health departments that are treating hepatitis C, and I anticipate that number to grow and just continue growing, as I know several of our regions are in the process of ensuring staff training and such as well. So I expect more in this just to continue growing. So we'll talk about where you can find this map and the addresses and locations for this as well. But here is kind of the highlighted counties. Next slide. So the viral hepatitis program has 3 sets of navigators, namely the viral hepatitis case navigators, viral hepatitis prevention navigators, and perinatal hepatitis C navigators. Each practice the same steps in navigation that are kind of highlighted here: identifying a client, engaging with them, providing education and resources, and then documenting that information. And for this session, we're going to focus on the first 2, and then in our next session, we'll talk a little bit more about the perinatal approach. Next slide. And as I said, a lot of what we're going to go over today is from a health department perspective, but it really does involve a lot of external and internal, for that matter, partnerships. And so hopefully we'll provide some resources and things for you all as well. And feel free to ask questions as we go. So next slide. So in January of 2017, the health department began, as we mentioned, conducting hepatitis C testing. And so at the same time, the Viral Hepatitis Case Navigator project was started as well. So they really work to address barriers to accessing hepatitis C treatment, assisting individuals living with hepatitis C to access different care and treatment services within their local area, as well as other supportive harm reduction services. And then really these navigators also liaise with community organizations working to cultivate program awareness and harm reduction activities. Next slide. So we now have staff in every region within the state that are providing this viral hepatitis education, resources and linkage to care for hepatitis C treatment providers, as well as some of those supportive services. Typically, the way to get in touch with a viral hepatitis case navigator is when a person comes into the health department and is tested for hepatitis C. Based on their test results, one of the navigators will reach out to them. So this navigator is reaching out when an individual tested at the health department has that RNA positive test or currently has hepatitis C, or if they were tested at a hospital or somewhere in the community and is identified as having acute hepatitis C, then our navigators also reach out to them. We also get some different referrals from some of the corrections navigators with the Department of Corrections as people are being released from corrections, and help those individuals get linked to treatment as well. Anyone who wishes to speak to the navigators can also, and there's a little bit more information at the link that's left here. Next slide. And then about a year or so later, we started with the viral hepatitis prevention navigators. These navigators work to assist individuals at risk for hepatitis C by linking them to different harm reduction services. They're also, of course, working a lot in the community and trying to build awareness as well. Next slide. So as of last year in July, we also have these navigators statewide providing viral hepatitis prevention education primarily, but then really also offering supportive services and linkage to care related to that also. Again, these are typically your individuals that are tested within the health departments, and based on their test results, perhaps they have a history of hepatitis C, so they would have had antibody positive but RNA negative results. They would be reached out, or someone that has antibody positive results, antibody negative results, but report a history of incarceration or past drug use or present drug use perhaps, then our navigators will reach out there also. And then I will say, this set of navigators work a lot in the community. So sometimes it'll just be word of mouth or who they meet when they're out in the community at different events and such, providing prevention education. So really anyone that wants to speak to them also. Next slide. We do have an internal team, if you will, called a central investigation team. While it wasn't mentioned earlier, they are working to streamline acute hepatitis B and acute hepatitis C field investigations and navigation. So one of the things that we're really happy to see them doing is every time we get individuals in the community or within the health departments that do have acute hepatitis, they're working closely with our health care associated infections department, trying to determine possible instances of drug diversion or clusters within healthcare facilities and how we can support some of that as well. So a team that started last year. While we've been doing this work longer, it recently came more internal, so, and at the central office level. So we're excited about that. Next slide. Each of our navigators work really hard to maintain what we call provider directories. These include resources throughout the state, really, and focus on making sure that we have resources that are easily available. So our navigators, when they speak to someone, they will provide information that is region specific, county specific, and really try to provide as much information as we can. So address, contact information, whether or not a person or facility rather is offering substance use disorder services, mental health services, what insurances are being accepted, things like that. And we're working on adding some of this, particularly those around hepatitis C, to our Project Echo website. And so this will be, some of it will be available as well, and facilities are going to be given the opportunity to add their own information too. So we are excited to see this coming together, but really it's about tailoring resources to clients as we're speaking to them. And so on the next slide, we will see what some of those resources might be. A lot of them are resources within the health departments that maybe someone is not aware of. And then there are also external resources, whether it be some of those SSPs that we talked about, other harm reduction services, support groups, things of that nature. Next slide. So we also are working on different resources for specific to providers, not just patients. So we'll talk more about that, and we'll try to go through these relatively quickly to ensure we have enough time for the case presentation. So next slide, and we'll start to pull up the TDH website. Okay, so here is the TDH website. Hopefully everybody can see it. You'll see that on the left-hand side, there's information specific to providers. And then on the right-hand side, there's more patient handouts and things like that. So on the left, you'll see things like treatment information, some links to go to for that. You'll see information about different training resources, as well as our EPI profile there at the bottom. I think it's under supplemental and surveillance reports. So you'll see some things about your region. There's testing information for infants and adults both. So just a lot of different resources. And then, as I said, some educational resources. And then if we scroll closer to the bottom, we'll see more of an explanation for some of the different projects that the hepatitis program helps support, and links to find out more information about those as well. So a great resource to find additional resources. So Heather, if we want to switch over to the In This Endemic website. So this is our Project Echo website. Here's kind of what Lindsay was talking about earlier, and where maybe some of you have already been, but if you scroll down, you'll see where to register there on the right-hand side, an interesting article about kind of the impact of being able to offer telemedicine and kind of telehealth training opportunities and such, and how really it talks more about that and kind of how the program started. And if you continue scrolling down, you'll get more into the case presentations, what type of topics we're going to be talking about, as well as that wonderful purple button there, the big purple button that says that you can submit your own case presentation requests or topics or speaker ideas. So please don't hesitate to go click that button. And then underneath it, you will see viewing past recordings, the red button that Lindsay talked about earlier. And then if you want to share the word and spread the word, there's a flyer that you can download as well. And then as you scroll down, you'll find more resources specific for providers, our SME team and our team. Keep going, accreditation. And then here's where it talks about some of those resources again that may be of interest to you in terms of different training resources, information about treatment and testing, and then the button about additional resources. And that button we are working to update. And we'll be providing some of those directory and things that we talked about. So then going over to the additional resources and in this endemic, up at the top, you'll see that there's under Many Voices, One Plan, you'll see this Finding Resources button. And then you will be given a whole page, really a lengthy page of a variety of resources. So there's all different types of things here. Each one has a little bit of a description underneath it. It'll talk about some of those harm reduction services, different things in the different areas, across the state. And really at the top, you can focus down on, like, is it services that are related to hepatitis? Is it HIV, STI? So just a variety of resources here. So kind of a great landing page if you're looking for other things to share within clinics as well. So switching gears back over to the PowerPoint. And we talked about the website, so you can just go ahead. And I see Lindsay dropped them in the chat, so that's great. So switching gears a little bit, talking or just highlighting some of the TennCare restrictions when we were talking about prescriber restrictions. So looking closer at prescribing hepatitis C medications in Tennessee, the Hepatitis C State of Medicaid Access recommends Tennessee no longer requires prior authorizations of all direct interacting antivirals or DAA medications, direct acting antivirals, DAA medications, or documentation of chronic HCV or genotyping. And so I will say, though, we're still graded at a B, which is pretty good compared to especially how things have gone in the past. So going on to the next slide, we'll see that as of last year, March of last year, TennCare did drop sobriety restrictions and removed questions related to renal function and pregnancy from the HCV DAA prior authorization forms. So that was a big step in the right direction and getting rid of some of those restrictions. So consequently, our updated score is a B. And you'll kind of see in this map here where we are comparatively to other states. And I feel like we are moving in the right direction. So that was exciting news to share, especially as it came about last year. So next slide, I'll pass it back to Lindsay.
Great, thank you, Mia. Okay, so just wanted to quickly conclude our presentation with a recent article that I think you'll find relevant and interesting. I'll also drop it in the chat. Next slide. So an MMWR vital signs released in August of 2022 found that hepatitis C treatment rates among insured adults are low and vary by age and insurance payer, with the lowest DAA treatment occurring among young persons, Medicaid recipients, Black individuals, and in states with treatment restrictions. Next slide. Okay, so with that, want to open it up to any questions that you all may have. I know that was a lot of information that we threw at you, and so happy to answer questions now.